Hello there. Happy Black History Month and happy February. It's been an interesting month to say the very least. And so today I want to talk about case management, social work case management to be exact. There is some overlap between nursing and social work, but it really depends on what region of the country you work in, which hospital you're at, because everybody runs differently. And because I am a social worker, I can only speak on social work. So if you have any questions, make sure you drop it below. I think now more than ever is such an important time to make a note of the skills that we have, what jobs are out there, just because everything is just so crazy. And while I don't wish anybody to be laid off, I want to help you understand kind of the realistic view of being a case manager in the hospital and what that day-to-day life looks like. And also what skills might be important, skills that you may already have. And, they tend to say, healthcare generally has more security or stability rather when it comes to impending recessions or economic swings. And so again, I'm not wishing anyone any harm, but let's talk about what the realistic day in a life looks like for a case manager in the hospital setting. So in terms of hospital social work, it can look a couple of ways, right? You can be a medical social worker, which I think I've talked about before in a previous video. You could also be a case manager. And also you could be a social worker within the psych setting, right? So inpatient psychiatry setting, depending on the hospital that you're working for. And so for the purpose of this video today, we are going to focus on case management. Now, case management really is a unique role within healthcare where it really requires an individual to sort of be knowledgeable of the processes within the healthcare setting. And what I mean by that is just like being mindful of insurances, and not to the extent that you have to know what the patient's going to pay for the copay and things of that nature, but understanding like the limitations that some insurances have. Particularly when I think about our elderly population, and some are going to need rehab and they're going to transfer over from the hospital, the acute setting. And so all those things kind of matter. Those are things that you're going to constantly be juggling. So it really is an individual. In a lot of ways, I compare case management to project management. Right? Think about your patient as the project, right? And you're sort of seeing the patient from start to end and making sure that that transition is as smooth as possible. You're putting pieces into play, right? Like you're coordinating services. In a lot of ways, you're coordinating with stakeholders, right? That's very similar to project management. So it really is a way to sort of leverage skills that you have had maybe in previous roles. You have to be a exceptional communicator. And if you're not, don't fret, because I do think you can grow within your ability to communicate, right? It's going to put you sometimes in uncomfortable positions. I've been in situations where as case managers, you're expected to present on each patient on the floor to the doctor and get feedback from them in that way. And so it forces you out of your shell in so many ways. And so in a lot of ways, it's super beneficial. And there's just so many skills that you can take from this role and apply it to others if that's what you decide to do. So in terms of daily responsibilities, pretty much how it goes particularly is first things first, you want to assess, right? And you don't know what's going on. You don't know what you're headed towards until you assess or complete an assessment. Now, the hospital that I'm with part-time now, we are required to do an assessment within 24 hours. That's pretty standard for every hospital, because when I've been on previous travel assignments as a case manager, it's the same thing. Within 24 hours, patients needs to be seen by the case manager. And so during the assessment and evaluation, what you're trying to do is understand, what was the client's, you're going to hear me say client and patient, intertwine them, because number one, I'm a social worker, but then being in the healthcare setting, patient versus client, but they all mean the same thing for all intents and purposes. So you're really trying to understand what the patient's life looks like, right? What they came in from, what they need, what they don't have. And so that helps us understand what are possible things that we need to be putting in place when the patient is discharging. So those are really important factors what we're trying to gauge and understand when we're doing our assessment and needs evaluation. And then the second part of that is sort of discharge planning and coordination, right? Which is another big part of this, is that okay, so this person is here at the hospital. They've been here maybe few days. Maybe they, had a knee surgery, and now the doctor and the rehab team is recommending that this patient goes off to a skilled rehab facility for ongoing care, right? So your role as a case manager is now to initiate that referral, but not only just initiate that referral, setting up transport, making sure that insurance we get the authorization from the insurance to make sure that they can actually go and the insurance is going to pay for it. We're also going to make sure that they're going to a facility that they actually want to go to, because the patients have a choice at the end of the day. And so we want to make sure that we're advocating for them in that way. And so we're sending out the referrals, right? And depending on what system you use, there's a lot of different systems. There's CarePort. Some people do it through Epic. Like, there's just so many systems, case management software systems. And this is why I say, again, it's a lot like project management. But I digress. But so yeah, you're figuring out where this patient needs to go. And part of how you figure that out is through your assessment, right? And I do that and I ask that early on. So like, I always say to clients who I suspect, just because you kind of get a general understanding of like some of the prognoses, treatments, and what the disposition will be, because like after doing it a while, you'll just know. So I have a conversation. I'm just like, if the recommendation is that you need to go to a subacute rehab or you need to go to a skilled rehab facility for ongoing care, are you open to that? Are there any skilled rehab facilities that you know of that you absolutely hate and don't want to go to? Like, is there like a top 3 that you have in mind, or that maybe your family members love and know of, like, or maybe you've had a family member go to one before. And so I'll get that information early on because I can start getting the ball moving earlier. Time is of the essence as a case manager. Time is everything. So making sure that you give yourself time to be able to put all these pieces into play is just so important. So like the earlier you can get it started, the better. Now, is that always possible? Not necessarily, but you will learn, you will find your way, you will find your rhythm, you will find a way to do the things that make sense for you. Prioritization is just so important. If I always think like, man, for my folks and my colleagues who have ADHD, this thing can be overwhelming. So you have to find a way that works for you. You have to find a system and a flow. But prioritizing is the first, and it's a non-negotiable. You have to learn how to prioritize, and you prioritize based off the needs of the hospital, right? And so often what that looks like is like discharge, right? Getting the patients that need to be going home or to their next place, they need to be going. Assessments need to be done. And the coordination of care needs to be done, right? So in terms of prioritization, I would say that is generally the ranking for case managers, regardless of what facility you're at. Of course, give or take, it can change. But generally speaking, I think that is like when we think of prioritization, that's what it looks like for most case managers. And then, of course, you're going to have some cases where you have to deploy some crisis intervention and crisis management, right? You have maybe some clients or patients rather who are upset, who are displeased with the disposition, or maybe the way doctor said something to them or something happened. You just never know. And so often as case managers, you're going to come into that. And so that's where you're going to incorporate some of those social work, crisis de-escalation skills. That's where all that comes into play. And it's also important to note, like, while we are social workers coming into this role as case management is really different from being a social worker, right? So in a lot of ways, as social workers, we are empathetic, we're listening, we're sitting, we're supporting, we're validating, we're giving people time to process. Case management is not that, right? Because you get that directive from up above, from the medical director or whatever have you, or your clinic director, or whatever the director is, that, this patient needs to go. And so you need to make sure that the process you're flowing is, you're going through rather, is in respect to that, right? And so we're getting people through this sort of process, and we're getting them home, or we're getting them placed in a timely fashion, because time, again, is of the essence, and time is just so important in this role. So being mindful of that. And also family meetings and support. There are going to be families that are scared, worried, afraid, have so many questions, overwhelmed. And like, again, as a case manager, you're going to be inundated with a lot of that, right? Because in a lot of ways, you're the first line of you're the direct line of communication, because most times people can't reach the doctors. Nurses are super busy on the floor. It's not that we're not super busy, but like literally our role is to communicate, right? So we're communicating with family members as well as loved ones, and making sure that we have the release of information signed, making sure that they're listed as an emergency contact, making sure the patient has given us permission to speak to this person, and if they don't, making sure that we note that, and that we respect that this patient has asked us not to speak to this person despite whatever connection or relationship they have. So that's really important. And then I would say the other sort of skills, if you will, or important things to kind of keep into consideration as you're navigating this role is interdisciplinary collaboration is just so important in this role. You are working on a team of physicians, doctors, physical therapists, occupational therapists, nurses. Like, all of us are a team, and sometimes people let their egos get in the way, but we all have to get back to what the point of us being here is, and that's the patient and patient care. And so I'll say that because I know y'all know there can be a lot of things that go on in the hospital settings and things like that I could care less for, especially the like pettiness. I'm not interested in that. At the end of the day, I'm here for the patient. Not only just that, you got to remember what your role is, right? There are going to be people that try to offhand stuff to you. And so like boundaries are going to be very important, right? So people are going to ask you to do things, and that's just not within your wheelhouse. So if that's outside of your scope of practice, that's something that I have to lean on oftentimes, and I'll give an example, when, say, for example, I've been tasked with ordering a particular medication. I'm just like, this is outside of my scope of practice, right? I'm a licensed clinical social worker. I'm not going to order this patient's medications and have that get messed up, and then that be on me, and then also in turn be on the doctor as well, because the doctor orders the medication. So it's little things like that. And it's going to depend on the hospital that you're at, the state that you're at, but things like that can happen. So something to just be mindful of. And that's something that you definitely want to communicate with your managers and your leaders to make sure if that's something that's happening, you're uncomfortable, you notice that it's outside of your scope of practice and ultimately can impact patient care, you definitely want to bring that up. And then effectively communicating and advocating for our patients, there's a fine line. And then again, this is where that social work versus case management issue comes to play again, right? Like, advocacy is important, but then we have to also understand that advocacy within the medical setting as a case manager is going to look a little differently, right? Patients do have a right to appeal discharges, right? And we let our patients know that upon coming into the hospital, we let them know their rights. And then there are instances where maybe the appeal gets overturned, and it goes in the favor of the medical facility, and so that patient does need to be out within the next 8 hours, and then you get the message and you're just like, the patient needs to be gone, right, per Medicare. And so that's when you collaborate with your team, or if you have any concerns, go back to your manager, right? That your manager is supposed to be a resource, a tool for you to kind of help you navigate this. There are going to be some uncomfortable conversations and uncomfortable situations that may come up, and so using them as a support to navigate that. But that is sort of when that whole being a social worker and advocating versus being a case manager and advocating, but also within respect to insurance and the healthcare system that we're working in, because at the end of the day, it's about money in a lot of ways. And I'll just leave it at that. And then I will also just say that there are lots of challenges, but there are also a lot of rewards, right? People getting into a personal care home, for example, getting into getting rehab, right, in their home versus an outpatient setting, because there's just been so many transportation issues. And so things like that, right? And you get into that nitty gritty when you have these conversations with these patients, and you get to really know them. I remember I had a patient one time that I just sat with her in the ED for a really long time till her daughter got there, and she was just like, you know what, thank you so much. It was just such a pleasure to be with you and talk with you. And granted, she didn't get the outcome that she necessarily wanted, but we supported her in a way by putting resources and putting things into play for her so that she can transition home a lot more smoothly. So there are a lot of rewards, and there also are some challenges that do come with the role, if I'm being completely transparent. But all in all, it's a great way to build your skill sets as social workers, get paid pretty well, I would say. And then it's also a way to kind of just tap into different avenues of social work, right? I'm a firm believer that there are just so many ways we can utilize a social work degree. It really just depends on you. It really depends on how much or how you are able to sort of articulate your skill sets, whether that be through a email, through your resume, through conversation. You could really take these skills and apply them to so many different areas. And I alluded to case management early on because I alluded to project management early on because in a lot of ways, it mirrors each other in a lot of ways. So all that to say, case management, if you're considering it, I definitely say consider it, give it a try. Great way to get your foot in the door for the hospitals. Great way to get your foot in the door for travel work. Like great way to put your foot in the door to kind of just begin your career. Most, if not all, hospitals do tend to take MSW so that you don't have to necessarily be licensed to start in this role. So that's a really good thing, right? And like a lot of us have transferable skills that I truly believe can help us land these roles. So once again, thank you for tuning in with me today. And of course, if you have any questions, make sure you drop them below and I will talk to you soon. Take care.